Keith Dahlhauser. I'm one of the doctors at Cascade Eye Skin. We have Dr. Stephen Brady and Dr. Jerry Shields. The three of us have been doing LASIK surgery in the South Sound for years. We're one of the first groups to get a all laser LASIK. So we have one laser that makes the removal of the prescription, and the other laser makes a flap to combine to give you the quality of vision that we want.
At the initial consultation, there is absolutely no obligation for you to choose to have LASIK or PRK. The initial consultation is just to determine whether you are a candidate or not. And so we will use our cornea topographers to determine if your cornea has any hidden pathology. We'll do a clinical exam to ensure your eye is healthy and fit for refractive surgery. We're also going to take the time to discuss what your expectations are, as well as to outline the procedure and the post-op course. And after that, it's up to you. You can think about it and make your best decision.
Is very, very good for distance vision. Unfortunately, like myself, I'm around 45 and I'm starting to need reading glasses. In people over 45 to 50, LASIK often doesn't correct the need for reading glasses afterwards. However, there is something called monovision, where we correct one eye for distance and one eye for up close. A lot of people already do this with contacts, and if they do, we do it with LASIK and it corrects both the distance and the up close. If you've never tried monovision before, we'd be happy to give you what we call a contact lens trial, where we give you contacts to wear for a period of time to see if you like the monovision. If you do, I strongly recommend you doing monovision because it corrects both distance and up close. If you don't like it, you will just need the $5 to $10 reading glasses afterwards.
LASIK does correct astigmatism. That's a common misconception. It corrects farsightedness, it corrects nearsightedness, and it corrects astigmatism. There's certain limits that the laser can go to, and if you're beyond those limits, if your eye has too big of a prescription, then you would not be a good candidate, and we would let you know.
LASIK is very successful if done on the right person. Unfortunately, if done on the wrong person, it's not successful. That's why we do a complete, thorough preoperative examination, including corneal thickness, corneal topography, refraction, and a complete eye exam. Things that would disqualify you to have LASIK would be an abnormal shaped cornea, an abnormally thin cornea, or a prescription that is out of the treatment range.
The age range for LASIK, youngest, is 18 years of age. That's for those patients that don't have a large prescription. So the FDA study said that we could do anybody 18 or older for medium prescriptions, but for higher prescriptions, we'd like to usually wait till they're about 21 years of age. That makes the prescription more stable before we do it. And we can do LASIK on people up to 90 or 100 years old, and I've done things like that. For some people after cataract surgery to shift their focus or fine-tune things, LASIK can be used at any age after 18.
With the technology we have at Cascade, which includes a wavefront topographer, a Vizix S4 laser, and a femtosecond flap-making laser, you may actually see better than you did with contact lenses or glasses. This isn't always the case, but this is always our goal.
We offer all types of refractive surgery. Often people only know about LASIK, but there's actually a multitude of different modalities to decrease your dependency on glasses or contacts. We offer LASIK, and we do the all laser custom LASIK. So in LASIK, there's two steps. There's creating the flap and reshaping the cornea. We use a laser to do both of those. The reason we do that is it's the safest and most effective way possible currently. Some people aren't candidates for creating a flap, so we offer also custom PRK, which uses the same laser to reshape your cornea, but instead of creating a flap, we remove the outer layer, reshape the cornea, and allow the outer layer to grow back. Another option, even if you're not a candidate for laser correction, is a clear lens extraction, or what we call a refractive lens exchange. We'll talk about all these options at your preoperative evaluation and tell you what is the most effective, the safest, and the most cost-effective way to get you out of your glasses and contacts.
So surgery generally takes about 30 minutes, and 30 minutes doesn't include all surgical time, but it is the time inside the operating room. The reason why it takes 30 minutes is because at Cascade we have a femtosecond laser that makes flaps, and we also have a Vizix laser that is for the laser treatment. Both of these lasers do separate things, and they're in separate positions, and so there is some positioning which requires a little extra time. It also creates an extra safety factor. Having a femtosecond laser is a much safer way to make flaps than the old-fashioned way with a mechanical microkeratome, and so approximately 30 minutes.
LASIK is not a painful surgery in that you don't feel any sharp pains on your eye, but you feel pressure from 1 minute out of the surgery. For 1 minute of the 10 minutes surgery, you're going to have a device that holds onto your eye that makes you feel pressure. And that's kind of an ouch, like stop pushing on my eye kind of a feeling. So beside that, during the surgery itself, when you're done with the surgery and the numbing drops wear off, then you're going to feel scratchy, like there's sand or gravel in your eye. So going home and sleeping is the best way to pass time to help that feel better.
LASIK is a very safe surgery, however, complications, just like with any surgery, do happen. We take that seriously here at Cascade, and that is why we see you preoperatively to make sure you're the ideal candidate, perform the surgery, and just as importantly, see you afterwards for your post-op, because if the rare case there is a complication, you will be seeing the most qualified physicians to treat that. The rate of LASIK complication is very small, very similar to the complication rate of wearing soft contact lenses. Most common complications that you hear about is dryness and glare at night. I don't think these are complications. I call them a side effect because they actually occur quite frequently, 30 to 80% of people. Luckily, they're very easily treated with artificial tears and sometimes other measures for dryness, and are self-limited to a couple weeks to a couple months. More serious complications involve the flap. We here use the all-laser LASIK only because the risk of making a flap with the laser is much less than the microkeratome. This will be discussed in length at your consultation with your surgeon. Other complications with the flap can be post-operatively, where the flap is slightly dislodged, completely dislodged, or wrinkled. That is why we demand that you come back the next day, because I tell people it's kind of like if you're drying your clothes in the dryer and you take them out, it's very easy to get the wrinkles out. If you leave them in the dryer for a week, it's very hard to get the wrinkles out. So that's why we see you the next day, and if we do see any stria or wrinkles, we'll take care of it that day. The most serious complication is an infection. We take surgery very seriously here and do it completely sterilely, and we treat you with antibiotics afterwards. Unfortunately, there's still about a 1 in 10,000 chance of losing vision due to scarring from infection after LASIK.
After LASIK, there is a certain element of wow factor depending on the refractive error going into LASIK. If there's a high refractive error where you haven't been able to see without glasses, then after LASIK you will be able to see. However, since the surgery just occurred and there was manipulation of the cornea and surgery, the vision right after LASIK is generally almost like looking through wax paper, and that's normal. It's generally after a short rest period and a night of sleep when the patient experiences the big wow factor.
After completion of your surgery, we'll go over the post-op instructions. The main thing the day of the surgery is to go home and keep your eyes closed. That day, you'll have mild to moderate discomfort. Usually some people will take a Tylenol or Advil for the discomfort, but most people will go home and lay on the couch. The next day, you should wake up and notice a pretty significant improvement in your vision, and most discomfort should go away. Over the next couple days to a week or two, your vision will slowly and slightly improve in quality. For the first couple days to weeks, you will fluctuate a little bit, and that's helped with artificial tears. But most people are back to their normal activities the next day. Most people return to work the next day. We do ask you not to do contact sports for a week to 2 weeks, not to swim for a week, and not to wear eye makeup for a week. But besides those, you're usually back to your normal activities the next day.
Glare and halos in the Pacific Northwest is very common for everyone. However, after refractive surgery, it isn't uncommon for glare and halos to be slightly enhanced. However, thanks to neuroadaptation, these are very, very rarely an issue after surgery.
One of the differences at Cascade is the personal attention that you get from your physician. So we see you ahead of time, do the pre-op counseling, measure your eyes ourselves, do the surgery, the surgeon does the surgery of course, and then the surgeon himself sees you afterwards. So it's a surgeon all the way through the different steps, as opposed to non-surgeons doing part of those steps in other practices. Another thing that sets Cascade apart is the quality of the equipment. So we have, instead of a blade to cut a flap, it's a laser-made flap. We use the most commonly used laser flap creator because it's the one that works the best in the hands of ophthalmologists. And then we have an up-to-date laser treatment to remove your prescription based upon a computer scan. So the high technology that Cascade maintains, along with the personal attention that you get from the individual doctors.